We have one more speaker. This is JOANN NILSON, who's a physiotherapist at the Royal University Hospital in Saskatchewan. And she's going to be discussing strategies to better serve the mild bleeding disorders population. And as we kind of briefly heard about earlier, the HERT tool. So I'm very much looking forward to this. Welcome, JOANN.
Hi, thank you for giving me the opportunity to come and talk about HERT. I'm going to give you a little historic tour of the sort of physiotherapist thoughts over the last while and talk about HERT. So I will just go forward, just the green button here. Yep. So my outline, I'm just going to talk a little bit about mild hemophilia, but I think you've got a really good basis from the probe and the former two speakers, so I won't spend long there. But always the unanswered question is, why do people with mild hemophilia not recognize bleeds and access treatment and healthcare in a more timely manner? We developed, meaning the physio group here, developed a tool and not a pamphlet, and just our journey. And in this, we really weren't able to develop any educational tools till we had great patient input. What we came up with, the patients liked it, and the physios did too. And I think now, the reason I think this is a wonderful opportunity is I think now more than ever before, with the new treatment products, everyone's kind of got that mild hemophilia phenotype. So mild hemophilia, like we've said, there's often very severe consequences. And I think there's been lots of studies about the neglected diagnosis with distinct and specific diagnostic treatment challenges. Being that wide range from 50 to 40, yes, it is a wide range of clinical presentations as well. And I'm just going to touch really briefly. The oldest study I could find was a documented hip injury way back in '64, unrecognized hip bleed that ended up in an eventual amputation. A couple thigh contusions that happened at sick kids, 15-year-olds that didn't report till at least a week later. So all presented to treatment more than 1 week after the initial trauma, and that led to those severe consequences. So why do people with mild hemophilia not show up to access in a more timely manner? So in 2002, the CPHC, we identified the people with mild hemophilia as an at-risk population, and we were asked to help write up some pamphlets. But we found, you know what, we really didn't know what to put in that pamphlet to have any impact on these young men. So we thought we needed to understand how they perceived their condition, and so we needed to talk to them. So we did get a Care Until Cure grant in 2006, and I'm just going to talk a little bit about our research journey. And we felt in step one, we really needed to ask the experts. So I just popped this picture up because this was our original mild hemophilia physiotherapy committee. And in the middle there was a unbiased qualitative researcher, Dr. Candace Schachter from Saskatchewan. And she helped us with this title, Create Meaningful Messages for Individuals with Mild Hemophilia Through Consultation, Integrating Grounded Theory and Action Research. And that's something that we were not capable of. So through the Care Until Cure grant, we did a national multi-phase study through individual and phone interviews. We had focus group with the physios and with the young men with mild hemophilia. And Candace was wonderful because she did not understand hemophilia at all. So she went in and asked very good questions, and it wasn't a healthcare professional asking the questions. So they didn't have anything to hide, and it was not going to affect their treatment at all. So I think we got very rich data. We did publish this data, and it's many years ago now, but it's the qualitative study identifying the knowledge, attitudes, and behaviors of young men with mild hemophilia. Our demographics of the 18 young men that we were able to study were very similar to the probe study. You know, they were aged 17 to 31, 14 with factor 8, 4 with factor 9. Age of diagnosis was a real range, 0 to 16. And I think the very interesting thing at that time is 9 of them had no clue what their factor level was. And it didn't seem to impact on them at all. We took a little bit more information. What was the reason for their last reported bleed? And 62% were sports or musculoskeletal injuries. And there was only only I think 2 participants had no bleeds at all. And their disease does impact them greatly because 2 of the 18, they had missed 12 to 20 days in the last year due to some injury. So their condition was very much impacting their lives. So what the young men told us was they tended to resist or ignore their condition or diagnosis. They felt normal, therefore they were involved in lots of not recommended sports. Many felt that the education and recommendations provided by the HTC did not apply to them. They weren't in that serious category, and they relied on their own experiences of that or of their siblings. And most did not have a good understanding of the signs and symptoms of bleeding. And that's what really twigged with the physios, and we thought, well, that's something that we maybe could do something about. The strategies that they used were they'd compare their bleeds to previous bleeds. Oh, I got hurt way worse last time, and it wasn't a problem. They'd ice, take it easy for a few days, and wait and see. They'd call their brother or cousin for advice because the doctor wants me to take every bleed way too serious. And of course, there's also that denial and procrastination. It'll get better on its own. I don't have time right now to go get it checked. So I think this little diagram happened in the airport waiting room. Where a couple of physios, we were waiting for our plane, and we thought, well, let's try and make a self-assessment pathway that'll work. We tried to use our clinical guidelines, but we really wanted to emphasize the regular reassessment and when to call the HTC. This developed into a paper version, which really cycles and says, okay, what are you looking for? You're looking for warmth, pain, swelling, and loss of movement. And you want to check that immediately at injury. You cycle back, you check it in an hour, you check the next day, and you check in 3 days. And this we needed to take back to our young men from mild hemophilia. So first we asked the healthcare professionals if they thought it was okay, and we got a yes. And then we also brought back 14 of our young men and asked them what they thought about this type of thinking around an injury. The comments from the young men with mild hemophilia, well, if I was unsure if I should seek treatment, this would be a really good reinforcement to do it. Because at each episode of reassessing those 4 parameters of a bleed, they were asked if it gets worse, call the HTC. If it stays the same, maybe you're okay. So, but check it the next day. So it was always, if it gets worse, check. I liked it. In different situations, it goes back to reassessing the thing quite often. I like that because it feels good for one day and you don't think about it and you can aggravate it or trigger a bleed. So we asked them, okay, we were thinking a wallet card originally. We thought, oh, we'll create a wallet card with those things on, and the guy says, no way, is there an app for that? So that's how even we went to the young men, and they wanted an app. So we went back to them and says, well, what should we call this? And so we even had a vote about the name, and so we came up with the Hemophilia Injury Recognition Tool. And on HURT, you can see that there's a question mark after because it's trying to get them to respond. It's trying to get them to take action. HURT? And so that's the name of the tool. So we knew nothing about creating apps, and so we collaborated with the computer scientists at University of Saskatchewan, Dr. Richard Lamodi. It was launched way back in 2014, and we actually won a couple of awards in Manitoba and Saskatchewan from the Canadian Wireless Technology Communication Association. So they were very happy that we were kind of doing patient participatory research and that it was engaging patients to contact the hemophilia treatment centers. HERT is an injury self-management tool, and just reviewing the principles of self-management, what do? You problem solve, you decision make, how do you find and utilize resources? You want to form partnerships with your healthcare providers, and you want to take action. So HERT, it provides the parameters to identify the signs of an injury. And the men that evaluated this, they say it wasn't good enough. So with those signs, with the warmth, the swelling, the lack of range of motion, and the pain, each time they assess it, they grade it in a 1 to 10. So it's a sliding grade. So maybe when they first have it, it's 2, 2, 2 all the way across. They review it in an hour, and it might go up a little bit, and it's still okay. The next day, it's up to the 8s and the 9s, then they know to call. So that's the spurring on to call. It does give guidelines for first aid measures, and that it prompts you in 1 hour, 1 day, and 3 days, and it facilitates that contact with the hemophilia treatment center. And in our app, we had direct lines to all the hemophilia treatment centers, so they could do that act right within the app. And it also had a detailed assessment form for diagnosing muscle bleed as opposed to ankle bleed, which is the one that Kathy Mulder developed several years ago. So the app was evaluated by a mixed method research design, and that was my master's thesis. I engaged 12 young men from 6 different provinces, similar age groups, and diagnosis, mean age of diagnosis was 7.3 in this group, and 4 of the 12 did not know their factor levels. I did a qualitative arm of the study as well as quantitative data. The qualitative themes that came out were, this is accessible, it's at your fingertips. I can assess, where I'm injured. It was useful, and I can assess from the crime scene. One guy says, man, I have it with me. Where I get injured, I can assess myself. And the alarms really were well appreciated. When you get busy, you kind of forget. And the credibility was often, these guys have heard this information before, but they were they said it's credible because I've heard this before, but it's reinforcing it. And the confidence level was very interesting. It gives you more information on what to do, but my quantitative data, actually their perceived confidence levels with the app and without was noted as significant. And it was they said it's reaffirming to have that information with us. It's like a second set of eyes. It built my confidence in my assessment. And one of the real notable things that from talking to these guys too was they said, now when I phone the HTC, I know what to say. Because I think a lot of maybe people that aren't knowing how do I assess a bleed, now they can say, you know what? The warmth is getting worse, and the swelling's getting more, and I can't move it as well as my other side because we have all these prompts in there, and they feel that confidence to contact the HTC. Recently, I polled our physiotherapy members, and I got consensus yesterday just on the HERT app. Unfortunately, it's a dead app right now. It's not available because technology-wise, I'm not a technician and I don't have unlimited finances. So now with the new landscape and all the new treatment products coming online, and many, like just with the talks today, it's many people are in that mild phenotype and maybe not recognizing bleeds or not noticing those signs when they should contact the hemophilia treatment center, that we're thinking this HERT app needs to be revived. So the physio said, I liked suggesting this app to my patients to use to help determine next steps and when to call for help. I have found with the new therapies, most of my patients have difficulties being able to identify signs and symptoms of a bleed despite reviewing the information at clinics. Patients are not recognizing breakthrough bleeds and end up needing more product for longer. Both novel therapy and regular prophy patients often think it's just a sports injury and then present a bit late. There is this study that was just published recently, and it compared ME-treated hemophilia A patients and people with mild hemophilia A, and their bleeding patterns from the both groups were very, very similar. And so, you know, really, in conclusion, ME-driven coagulation has potential to be reflected as mild hemophilia A. So the next steps with HERT is we feel HERT could be a useful tool for all people with bleeding disorders who experience musculoskeletal bleeding. And that would be all severities of hemophilia, type 3 von Willebrand's, women with bleeding tendencies. We just had a talk this morning about how they have experienced joint bleeds as well, and a lot of the rare bleeding disorders that do have some bleeding tendencies. There needs to be some further consultation with people with all bleeding disorders and the healthcare professionals. The ideal scenario from the physiotherapy group's perspective is if it could be incorporated into the new MyCBDR that is now being developed and initiated, hopefully, in the near future. And we maybe will need to also think about a standalone app, as BC and ICHIP or international use could be potential. And we actually are meeting in June to kind of review and update the app and prepare it for that next step. I also wanted to feature the mild hemophilia book because the app is not functioning, so there is a lot of great information, and I flipped through it, and on page 11 it really does give you some of the signs to look for when assessing an injury. It's readily available on the CHS site, and I had the benefit of being on that committee that developed it, and I see many faces in the room that were also part of that book. So yeah, it's a great resource. We did get lots of support throughout our research journey, and I just want to, number one, thank all the young men with mild hemophilia that participated in our studies and really gave their experiences. The physiotherapy group, this wouldn't have gone anywhere without all the assistance of all the physios, and CHS, and of course some of our other funding groups from the Care Until Cure, the BHAP, and a couple of universities. So thank you.